assigns our viewers. As healthcare is blooming every day with new technological advancements, robots are assisting humans to enable a high level of patient care, efficient process, and safe environment for both patients and health workers. They streamline routine tasks and reduce physical burden on human workers. To give us more details on this, today we are joined by Dr. Chinnababu Sunkavalli, a renowned robotic surgical oncologist, Apollo Cancer Institute.
So, how many robotic surgeries have you done, sir, so far in Apollo Hospital?
Apollo Hospitals Jubilee Hills has done more than few thousands of robotic surgeries in the last 1 decade, and personally I have done more than 300 surgeries in my career, which includes gynec oncology and the GI oncology. So the experience as far as the robotic surgeries is quite vast and quite big in numbers.
What are the advantages of robotic surgery?
Robotic surgery is basically a computer in the operating theatre. So basically it's a digital surgery. So we have introduced the technology come into the operating room. So the advantages of robotic surgery are: number one, it is minimally invasive. So there is no big cut. There are keyholes. It's a keyhole surgery. So there is a less pain, there is early recovery, and less complications post surgery in terms of the lung infection, or in terms of the wound infections, or in terms of the surgical site or the other infections. And apart from that, the outcomes wise, patient not only has less pain and less blood loss, less infections, but the recovery rate is much faster, and early discharge is possible, and they can resume their normal work very fast compared to the regular traditional open surgery.
So, sir, usually how much time does it take robotic surgery when we compare it to traditional surgery?
Robotic surgery takes little bit more time than the regular surgery. For example, if you do a radical hysterectomy open method, on an average it takes about 3 to 4 hours, and robotic may take 1 hour more, but with more number of cases that one institute performs, the time difference is not much. In my experience, the time is not different at all compared to open and robotic.
So, what kind of robotic system does our Indian hospital use?
The robotic system that is available today is Da Vinci robot, and this is the only widely available robot that we have right now, and we have various models in it. So far we were using the SI model, but first time in South India we got the Da Vinci XI, the most advanced robotic system. So the XI model is the one which we are using right now.
Sir, in India, so far, what is the success rate of robotic surgery till now?
Robotic surgery has got wonderful outcomes, especially from the patient's point of view. The outcomes are much more superior, I can say, compared to the traditional surgery. So in most of the centers where the regular oncological surgeries are performed, the outcomes are much better, and though we do not have a concise or one kind of a report of entire country's robotic programs, but if you look at the overall presentations in our various national platforms where we discuss, definitely there is superior outcomes for the patient.
So, sir, in coming days, do you think that a complete transition of technology would take place?
I certainly envision a future where digital surgery is going to be the order of the day. Especially with in these pandemic times, I foresee a telesurgery to be a reality, wherein a surgeon is in one city and the patient is in some other city, and with the advent of 5G and with the advent of a better infrastructure for telecommunications, it is a reality, and it's going to be implemented very soon.
So, sir, what kind of surgery do we use? Like in robotic, we have so many things in surgeries, right?
Robotic surgery is most commonly used for gynec cases, including gynec oncology and even for benign gynec conditions. And apart from that, the widest use is in uro-oncology, especially for prostate cancer surgeries. This is one of the best modality to adopt. And we also use robotic for colorectal surgeries and GI oncology surgeries. And apart from that, the robotic is much more used even in the thorax for lung cancer surgeries, for esophageal cancer surgeries. This has been widely used. and off late people are also using robotic for thyroidectomy and for transoral surgeries also for some small lesions in the oral in the throat, wherein you don't have to do an open surgery and we can remove the tumor. So overall there are wide utility. Cardiothoracic surgeons are also using robot for their surgeries, and urology is coming up, gynecology is using it, gastroenterology. So overall in oncology again, quite a wide indications we have seen, right from the abdomen to the thorax and to the head and neck cancers.
So, sir, at present scenario where world is facing with the pandemic, so do you recommend a robotic surgery for the patient and as well as the doctor?
Certainly, pandemic is a condition in which we have now learnt social distancing and less exposure to the virus as such. So definitely in these times there is a utility and case for more robotics to be done. But at the outset, in any condition, pandemic or no pandemic, I think surgery is evolving more towards digital, and robotic is the future of surgery, I would say.
So, sir, while doing the robotic surgery, during some time when the robotic is not sensing a signal, so how do you react for that?
During the surgery, usually we don't have any technical snacks, but should there be a technical snack, usually it will be resolved immediately because every system is connected online, and there is a immediate rectification is done. In case we have a problem wherein one arm is not working, that then we need to work with the available arms and complete the procedure. So far in the last 10 years, we have hardly had such issues and technical glitches, especially if you are doing a telesurgery. I think that's where this problem can occur, wherein the signal transmission is issue, where the patient is somewhere else and the surgeon is some other city and you are doing a surgery. So that's where I think during the transmission of the signals there could be an issue, but within the operating room, surgeon being there close, there should not be a major problem.
So, sir, for the new wives, what are the courses available for a robotic surgery?
There are a lot of fellowship courses available. We have the training programs both in Apollo as well. The fellowship programs are here available, and even the Da Vinci itself for young surgeons who want to adopt this technology. There is a training program in Cochin and in Goa also. There is a training program by another company. So there are a lot of opportunities to get engaged and learn and adopt the new technology.
Sir, any message would you like to give for the people?
My message is that we are evolving towards pain-free, minimally invasive surgery, and I would say digital surgery is already here. It's not in the long future, but I would say the future is right here. We were able to provide the best outcomes to the patient through digital surgery. Robotic surgery is the future, and the future is right here. All the very best to Neuroscience Hub.